RDS. Okay? Again, RDS. Sinong affected, guys? Babies or adults? Okay? Babies or adults, the main problem are for your babies. Babies na premature. At pag premature ang babies, guys, most likely, magkakaroon ba ng premature lungs? Yes. At pag may premature lungs, anong affected? Magkakaroon ng bababang surfactant. And if there's low surfactant levels, guys, if there's low surfactant, there would be a lot of problem that would lead to atelectasis. Why? Because surfactant prevents your alveolar collapse. Now, if there is atelectasis, may hirapan bang huminga ang pasyente natin? Yes. So therefore, guys, what is the management? High flow or low flow oxygen? Low flow oxygen. Why low flow oxygen, guys? Because too much oxygen could lead to blindness for patients who are premature. Because RDS patients, premature babies, it could lead to blindness. Next, we can also promote stimulation or minimize stimulation, guys. Why? Because too much stimulation, guys, could overwork the brain of the baby, and overworking the brain of the baby could lead to problems. Next, what's the drug of choice? What is lacking? Surfactant. Therefore, what's the drug of choice? Surfactant then. What's the brand name? Survanta. Paano binibigay? Intravenous or intratracheal? The answer is intratracheal. Okay? So that is for RDS. Let's compare that to ARDS. Now, ARDS, guys, is acute respiratory distress syndrome. This is what is happening in patients with coronavirus, guys. Actually, the coronavirus, the reason why we're having FB live lectures right now is because of the quarantine that we're having right now. So what's the main problem in coronavirus? The main problem in coronavirus, guys, is that patients suffer ARDS. And what is ARDS in the simplest manner? It's atelectasis. And atelectasis, guys, is most likely what? Atelectasis is alveolar collapse. So this is the main problem. And we know, guys, that atelectasis would impair your gas exchange. And if there's problem in gas exchange, carbon dioxide will accumulate in your body and oxygen levels will be decreased. And if there's increased carbon dioxide levels, we know that this is highly toxic. Toxic. Too much carbon dioxide, guys, is toxic. On the other hand, guys, oxygen levels would be decreased, and it's also a problem. Why? Because we need oxygen in our body. Okay? So therefore, guys, ARDS problem is atelectasis that impairs your gas exchange, which is also the problem in patients with RDS. Yun nga lang, anong difference? Sa RDS, ang problema natin, premature babies. For ARDS, guys, the problem is that it's affecting our adults. Why? Because it's because of lung trauma. Okay? So for ARDS patients, guys, affected age group are adults because it is usually leading to lung trauma. And what is problem in lung trauma? Lung trauma, example, you got stabbed, nasaksak. You got shot, nabaril ka. Of course, I'm using English as well because I saw in the comments that someone is asking for examples who are for English. So therefore, yeah. Okay? So, what are the causes of lung trauma? Okay? Problems will be related to what? You got stabbed. Okay? Nasaksak ka. For example, you got shot. Nabaril ka. Nabaril. Okay? Saka ano? Okay? Pag ikaw ay ano, napana. Okay? You got shot by an arrow. Okay? So, therefore, guys, pag ikaw napana, okay, if you got shot by an arrow and napana ka, and nabarel ka, like nabarel, okay, and you got stabbed, nasaksak ka, so that is lung trauma, okay? And if there's lung trauma, guys, fluid can be affected. Fluid, air, blood will enter your lung cavity. So again, what is FAB? Fluid, air, blood. So we know, guys, that fluid, air, and blood can accumulate in your lung cavity. And what's the problem? Okay, let's go back. Okay, what will be the implication of that? Okay, the normal pressure of the lungs. Okay, the normal pressure of the lungs, guys, is negative pressure. Okay, so again, what's the normal pressure of the lungs? The normal pressure of the lungs is negative. So the entry of air is from positive to negative. So imagine the atmosphere is positive pressure. On the other hand, your lung pressure is negative. The entry of air is from positive to negative. So therefore, guys, the entry is from positive to negative. So that leads to air entry. Okay? And we need air for you to have for you to have sufficient oxygenation. Now, again, what's the normal pressure? Negative. The entry of air is from positive to negative. But because there's fluid, air, and blood, okay, konting-konti na lang guys, bibigay na din tong whiteboard ko. Okay? Lahat na lang sinusukuan ako guys. Sana hindi nyo ako sukuan dito guys. Konti pa. Okay? So therefore, abnormal is that if there would be pleural effusion. Okay? So therefore guys, if there's pleural effusion guys, we know that there's either fluid or blood in the lung cavity. And if there's fluid or blood in the lung cavity, or if there's pneumothorax, we know that pneumothorax is what? Air. Okay? So therefore guys, abnormally, if you have pleural effusion or if you have pneumothorax, pleural effusion entitles you to having fluid or blood in the lung cavity. Pneumothorax, guys, will have your air. So therefore, guys, what will be the problem? Okay, it will cause your lungs to have positive pressure. Okay, so going back, what's the normal pressure of the lungs? Negative. If there's fluid, air, or blood, it will become positive. Therefore, guys, if your atmosphere is positive and your lungs is also positive, therefore, there will be no air entry. So that's your concern. So therefore, guys, pleural effusion, fluid blood, pneumothorax, air, that will lead to positive pressure. Okay? So therefore, guys, if there will be positive pressure, what will happen? Positive pressure, guys, this is abnormal. Therefore, guys, entry is restricted. Okay, why? Because air enters if it's negative pressure. But because we have disorders like pleural effusion and pneumothorax, guys, most likely, guys, air entry will be inhibited. So what? If there's positive pressure, would air enter in your lungs? Yes or no? No. If air cannot enter, guys, it will lead to atelectasis. Promoting rest, guys, you're prioritizing yourself. Okay? You're giving proper oxygenation. Therefore, guys, you promote rest. Okay? Why? If you are really tired in life, in life your rest. Pag pagod ka guys, para ma-prioritize mo rin yung sarili mo guys. Grabe talaga bot. Okay, pag talagang pagod ka na, sakit na ng puso mo guys, magpahinga ka lang. Okay? So therefore guys, so oxygen. Okay? So what's the most important instruction? A. Inhale and hold. B. Valsalva. C. Exhale and hold. Dog, cough, and deep breathing exercises. So the question is about thoracentesis, guys. Remember, guys, in thoracentesis, guys, your main concern is that you want to promote removal of the fluid in your blood. Okay, we want to stay still. Okay, stay still. So that's your main concern. Okay, you want to stay still. So therefore, guys, why? In patients with thoracentesis, you want to stay still. Why? Because if you make galaw, okay, if you move, okay, the movement would lead to trauma, okay? Accidental lung puncture. Okay, accidental lung pressure puncture. Okay? So therefore, guys, our concern is that we want to promote the patient to stay still during thoracentesis, guys, because we want to prevent accidental lung puncture. Okay? And accidental lung puncture would lead to problems. So therefore, guys, we want to remove letter dog. Letter dog is a wrong option already. Why is letter dog wrong? Because coughing and deep breathing, guys, will promote the patient to stay still, to move. So therefore, guys, we want to promote the patient to stay still. So letter dog is wrong. Next, letter boy, Valsalva maneuver. Valsalva maneuver is used not for insertion but for removal. Okay, letter boy is for removal. Okay, up, CTP. Okay, so therefore, guys, sa thoracentesis, letter boy, Valsalva maneuver is for removal. So we're left with letter A and letter C because letter A and letter C, guys, are both holding. So therefore, guys, what is the better instruction? Inhale, hold, and exhale, hold. So for this type of example, guys, my advice is that you try to do it. Okay? So try to do it. Inhale, hold, and exhale, hold. So sabay-sabay tayo, guys. Let's go. Sasabay ka ba? Sasabay. Okay? So, which is better for you to stay still? Inhale, hold, or exhale, hold? So, let's do it. Una muna, inhale, hold. Inhale, hold. So, mahirap siya, guys. Okay? It's hard for you to stay still. Okay? During inhale, hold. So, it's better for you to exhale, hold. Okay? So, inhale, exhale. Okay, so better yung exhale, hold. So, the better answer is exhale and hold. Okay, so that's the better answer. Okay, so let's go and discuss thoracentesis. Okay, wait lang. Exhale, hold, easier. Okay, C for